The bucking horse and associated back pain. Horses that continue to buck despite professional breaking procedures may well be experiencing symptoms of neuropathic pain. This pain is usually referred from lesions in the lower neck and upper chest. The most common sites of pain or altered sensitivity are the wither and undersaddle region and the chest in the area of the girth. Please note we are not talking about professional buck jumping horses in this instance.
Today we're investigating a horse that basically is a young thoroughbred which has a history of chronic bucking. Certainly he's been ridden by riders who are able to stay in the saddle, but this began, I believe, when he was broken in.
Yeah, he's had issues since the first time he was broken in.
So basically from the first time he was broken in, he had issues. In fact, the first breaker just abandoned the task. That's how long ago now?
That would be almost 18 months ago.
So 18 months ago. Since then there's been a history of basically bucking in work. So obviously there can be a number of reasons, and in fact most young horses, in fairness, when they're being broken in, will at least try to buck, given that they're not born with this weight on their back, so they will try and remove it. But equally, being quite accepting animals, within a few days they usually accept the rider and on they go. However, in some instances like this horse, you'll get this continuum of this bucking. So then it becomes a question of, is there actually a physical problem that may be contributing? And in fact in this horse there is. So there have been two labels put on this horse apart from the fact he bucks, and one is that he has been referred to as cold back. So in the region which goes to about 2/3 saddle, if we apply pressure, as you can see, and that's just my fingers, he is objecting quite intensely. And the other thing is he has been described as being girth proud. Now girth is normally a sensitive area of the anatomy. I think we equate it a little bit to our underarms, but in the extreme you will get this sort of reaction. So if we think about this, if we apply a saddle here, pressure from a saddle, then do the girth up, then that sort of reaction should almost be expected. Now, sorry little man. Interestingly, if you look at this animal, he's actually very tractable. So he wants to be my friend, but having both altered sensitivity in this region of his anatomy and that, once you put a saddle on, do a girth up, and then just, it's a little bit like putting a tight strap around your chest if you have back pain and chest pain, and then throwing a monkey on your back. So is there any reason why this horse should not try and get rid of any weight that's applied to his back? Problem now becomes, what's causing this altered sensitivity? Now, with cold back, it may be myositis or muscle bone inflammation. Very simple, do a blood test, you'll know whether it is or isn't. Next, another condition that's often talked about in this region is what we call dorsal overriding of the spinous processes. And sorry, that's overriding of the dorsal spinous process is another condition which is often talked about. And that is, in this region here, the tops of the spinous processes may touch or start rubbing together. Now, interestingly, why does that happen? So, obviously, if it does, it can cause inflammation and, yeah, I need this here, Philip.
Yeah, push him over there.
Oh, I'll take him a little bit. Okay. So
you're not listening to the director when I say move or cut or action.
So with a condition called dorsal, so overriding of the dorsal spinous processes, which are these tops of these vertebrae here, what happens is, if the horse should normally work in this sort of position, his neck should be in this position. If for whatever reason, through pain or something, the horse is working with his head up and this part of his neck up, then you'll naturally get a turning of these vertebrae or compression of the tops of the vertebrae, and then you'll get the rubbing. So two choices when you have this overriding, which may also accompany altered sensitivity. You can remove the tops of the vertebra, or you can mobilize the neck or get the neck in a position where the horse will get its head and neck back into a normal position, and those vertebrae will no longer rub. Okay, now the other area, which is the girth, obviously you can get rashes and different things which can cause irritation, but they're quite obvious.
Again, the most common sites of referred nerve pain or altered sensitivity associated with neural alterations or trauma in the lower cervical or neck and upper thoracic, chest, vertebral joints are 1. The wither and undersaddle region to 2/3 saddle, and 2. The lower chest, particularly in the region of the girth.
Quite simply, if we are going to return sensitivity here and here to normal, then we need to mobilize this area of the horse's spine. And of course, under anaesthetic, as has been properly documented in human work with MUAs, you can actually mobilize the first thoracic vertebra by doing what we're going to do, as well as the cervical. So that's our form of treatment, and obviously post-treatment you can normally expect the first time he's ridden that he will have an habitual buck, but usually after that, that's the end of it. So it can be quite dramatic. So we'll treat him, and then we'll see what happens. If we look at this horse's neck, we tend to be straight to here. In fact, we're only flexing from about the third joint down. This is more or less like a piece of wood. So what we should have is a normal curve. And if we look at his lateral range at the moment, he's coming to a point about there. So what we're doing here is, by compressing in this direction, we're causing the outside of these joints to open up and move through range, obviously. And this horse has quite severe loss of range in the lower half of its neck, and one would assume that is also going into the first part of his thorax or chest.
To view the full treatment or cervical vertebral mobilization under anaesthetic, please go to the video entitled Horse Neck Mobilization. For more information on this subject and others, please go to drtomahern.com.